I am a minimally invasive gynecologic surgeon here at Rush. So that means that I've done OB-GYN or obstetrics and gynecology training, but I've done additional accredited fellowship training in complex benign gynecologic surgery. So that focuses on women with fibroids, advanced stage endometriosis, adenomyosis, ovarian cysts. The people who are potentially affected by these disorders are oftentimes maybe a little bit underserved by the healthcare system, and to be able to be a provider that they can establish trust with me and to listen and to address their concerns in a way that they feel empowered and respected. And that's one of my favorite things about my job. And it is incredibly rewarding to be able to work with a patient who's been suffering for a long time, to potentially do a surgery or find a treatment plan and then have them feel well again, and to essentially feel like they finally have gotten that relief that they've craved. That's the best feeling in the world.